Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent sciatica yourself. Place the edge of a large 4-inch in diameter unopened tomato can in the middle of the buttock. Lean back onto a painful spot and hold for 20 seconds. Then move to the side onto another painful spot and repeat the procedure. This is the piriformis muscle. If it hurts yet feels good at the same time, you're doing the right thing. It's so easy, your body weight does all the work for you. Continue for several minutes, then go back and treat the most painful spots again, especially if they burn. The burning sensation is due to the release of stored up toxins and indicates a problem that's been there for at least 6 months. Lean back further to add more pressure as the tissues warm up. The most common errors people make with this technique are using too small a can and sitting directly on the can, both of which will hurt and make matters worse. If ever your leg goes completely numb, it suggests that you're sitting directly on the sciatic nerve, so simply move to the side. If your sciatica is isolated to just this region, that's all you have to do. I'll now show you what you may have to add to your self-treatment if you have pain in the surrounding tissues. If your pain goes into the hip region, turn 45 degrees on the chair and lean sideways onto a painful spot. Hold for 20 seconds, then move to the side onto another painful spot and repeat the procedure several times. This is the gluteus medius muscle. If your pain goes into the upper buttock, take a chili bottle and place the lid at the top of the pelvis. Lean back onto a painful spot and hold for 10 seconds. Then move to the side onto another painful spot and repeat the procedure for several minutes. This is the gluteus maximus muscle. If your pain goes up into the low back, place the lid of a chili bottle just above the pelvis, lean back onto a painful spot and hold for 10 seconds. Then move to the side onto another painful spot and repeat the procedure. Continue for several minutes and go back and treat the most painful spots again. This is the multifidus muscle. Now turn 45 degrees on the chair and lean sideways onto a painful spot. Hold for 10 seconds. Then move to the side onto another painful spot and repeat the procedure several times. This is the quadratus lumborum muscle. If your pain goes even further down into the back of the leg, place your foot on a chair, lean forward with your leg straight and hold for 10 seconds. Repeat this 4 times a day. This is the hamstrings muscle. It's that simple. Try it for a week, treating yourself 20 to 30 minutes a day. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If it's less painful to sit, stand up, and walk, it's proof that you're healing, and you should congratulate yourself. If you treat yourself for 20 to 30 minutes a day, you should be completely healed in 2 to 4 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Light bruising may be normal for some people. If you're taking anticoagulants, take more time and use less pressure in order to avoid excessive bruising. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. You can even do this while sitting in front of the television. If you're sitting on a sofa, you might want to change the chili bottle for a longer wine bottle. If you're sitting on a leather chair, you may want to lay a towel over the chair in order to protect the leather from the edge of the can and bottle. In order to accelerate healing, avoid standing on one leg and crossing your legs. Always change sides often when shoveling, raking, or vacuuming. Once healed, if you ever feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of sciatica, if you heal yourself using my method, it's scientific proof that your sciatica was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, bursitis, osteoporosis, spinal stenosis, spondylolisthesis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of sciatica is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.